Welcome to Children First COVID Reopening and Operating Protocols Training for Parents. My name is Dr. Melania Kesoglu, and I'm the Director of Education. It is my pleasure to provide this training to you. Today we will discuss how Children First has incorporated CDC guidelines to provide your child with a safe and healthy educational experience. First, let me read you a letter from the leadership team. Dear Children First family, we hope that you and your loved ones are well. The health and well-being of the Children First community is our top priority. This letter provides an overview of the plan Children First has made to protect the health of our community during the COVID-19 pandemic. As the new school year approaches, we are hopeful that we may return to campus-based services. As soon as conditions are safe enough for us to return, we are prepared. Attached, you will find the Children First COVID-19 Reopening and Operating Plan. Our management staff developed the plan with input from our leadership team, policy council, executive team, our board of directors, our insurance agent, and legal counsel, as well as the Sarasota County Department of Health. This document addresses all areas of our program's operations affected by the pandemic. These include human resources, facilities, classrooms, offices, kitchens and meal service, child health, communication, risk management, and philanthropy. In each area, we have established protocols for the protection of health. Children First staff will make every effort to comply with the recommended practices detailed in this plan. We will require such compliance from all who visit our campuses. We will train all staff and parents on the plan. We will emphasize the protocols that affect our daily activities in the campus setting. All staff and parents will sign an acknowledgement that they have received this training. Please review the Children First COVID-19 Reopening and Operating Plan completely. It is through careful implementation of this plan that we will best ensure everyone's health when we return to campus-based services. Sincerely, Philip, Jessica, and Kathleen. Before we begin reviewing the reopening and operating protocols, let's review how to read the document. As I discuss the document, please follow along with your document. Each department is color-coded. Human Resources is colored green. Facilities is colored blue-green. Classroom practices are colored blue. Office practices are colored yellow. Kitchen practices are colored green. Children Health is colored orange. Communications are colored brown. Risk management is orange. Philanthropy is yellow. The task identifies the action step. The resource cites the source of the information. The detail illustrates how the task will be addressed at Children First sites. Each procedure in this protocol has been carefully considered and determined. Now we will take a closer look at each department. Let's begin with Human Resources. Children First wants to assure you that staff will not come to work sick. All staff members will be tested for COVID-19 prior to returning to work. Staff shall have their temperature taken upon arrival. If the temperature is 100.4 Fahrenheit or higher, staff will be sent home. Staff who come to the child care center sick or become sick while at the facility will be sent home as soon as possible. Each site will designate an isolation space. Staff who are supervising this area will have on gloves, gown, face shield, and mask. Sick staff will be separated from well children and staff until they can be sent home. Staff are advised to stay home if they feel sick. Those who are out for 3 consecutive days due to illness must provide proof that they are well enough to return to work. We have a plan in place in the event that there is a suspected and or confirmed case of COVID-19 within our facilities. In the event of a suspected case of COVID-19, an appointed site designee will issue instruction and direction to staff on notifying parents and stakeholders. The facility will close temporarily, and staff will be instructed to begin disinfecting procedures as outlined by the CDC and Sarasota County Health Department. If there is a confirmed case of COVID-19, The appointed site designee will inform the Children First leadership team as well as the Health Services Manager. The Health Services Manager will alert the Sarasota Department of Health. The Department of Health officials will provide guidance and next steps. In addition, the facility will close temporarily and reopen at the direction of the Health Department. Prior to the reopening, the facility will be professionally cleaned and disinfected under the direction of the Operations Coordinator and or the Executive Office and Operations Manager. Now, let's discuss the Facilities Department. Throughout our COVID closure, Facilities has ensured that our sites have had ongoing deep cleaning. Additionally, Children First have provided many upgrades to our facilities that promote clean air and reduce the transmission of the virus. Next, I would like to highlight just a few of the many tasks that the education team has completed in order to provide your children with a safe and healthy experience. The Early Head Start classroom cleaning, sanitizing, and disinfecting frequency checklist will be utilized 4 times daily to ensure the cleaning of the classroom. During each transition, all high-touch areas will be cleaned and disinfected. Also, we removed all soft items, including dress-up clothing and items that need to be laundered in order to be properly cleaned and disinfected. Wherever possible, carpeting will be removed, replaced, or covered with vinyl matting. Children's bedding will be kept separate and stored in individually labeled bins, cubbies, or bags. To prevent the spread of COVID-19, Children First has purchased scrubs, classroom shoes for staff, and masks for the staff and children. The staff have planned for increased hand washing throughout the day. Masks are required for all staff and children above the age of 2 years old. The classrooms have been designed to promote social distancing. We are limiting the adults who are able to enter the classrooms. We have reduced the classroom size for the Head Start classrooms. Staff who work in the office areas will stagger their schedules, increase the cleaning of high-touch areas after each use, wear masks while at work, and practice social distancing to prevent the spread of COVID-19. Nutrition staff will prevent the spread of the virus by adhering to the mask policy and wear masks while at work. They will increase hand washing and the cleaning of high-touch areas at the kitchen throughout the day. The nutrition staff will practice social distancing while working in the kitchen and delivering meals to the children. Lastly, they will limit the adults who might enter the kitchen. Now, let's take a look at the child's health area. First, we will discuss the arrival procedure. Consideration of health needs of children with underlying health conditions will be a priority. The Health and Nutrition Services Manager will work with the family to develop plans for attendance in the program. We will post signs at the gate or outside the center with a center telephone number for parents that arrive outside the drop-off and pick-up times. The staff will encourage parents to be on the alert for signs of illness in their children and to keep them home when they are sick. Ideally, the same parent or designated person will drop off and pick up the child every day. If possible, older people such as grandparents or those with serious underlying medical conditions will not pick up children because they are more at risk for severe illness from COVID-19. The parents will be assigned a time slot for arrival and pickup. The parent or guardian will drive the vehicle or walk to the designated drop-off site. A staff member will meet the parent or guardian there. If in a vehicle, the parent or guardian will turn off the air conditioner prior to opening the car window for the health check. The parents or guardians will wear facial coverings, such as masks, throughout the drop-off and pickup. During the arrival process, a staff member will ask the parent health questions about potential exposure for themselves or the child and document completion of health questions on the sign-in and sign-out log, such as shortness of breath, fever, cough, muscle aches, sore throat, decrease in sense of taste or smell. The staff member will conduct the child health check, make a visual inspection of the child for signs of illness, which could include flushed cheeks, rapid breathing or difficulty breathing without recent physical activity, fatigue or extreme fussiness, and then document the health check on the sign-in and sign-out log. The staff will take the child's temperature following CDC procedural guidance below. Perform a hand hygiene. Wash hands with soap and water for 20 seconds. If the soap and water are not available, they will use a hand sanitizer with at least 60% alcohol. Put on disposable gloves. Check the child's temperature. Children First will use non-contact thermometers and will not have physical contact with the child. Staff will follow the hand hygiene procedure again if there is contact with the child during the health check. Any child with a temperature of 100.4 Fahrenheit or 38 Celsius or above must return home. A short-term exclusion form is provided to the parent or guardian with guidance as to when the child can return. Let's talk about the infants. Children First staff will develop specific protocols that are compliant with social distancing practices. This might include the following procedure. The parent will remove the infant from the car seat and place the child in a Children First infant carrier. The parent will place the infant in the carrier in an agreed upon hello and goodbye spot, such as a table or a bench. The staff member will maintain a safe social distance from caregiver as the caregiver says goodbye to the child. The staff member will then greet the child and bring him or her in the carrier into the facility. Carrier will be disinfected in between uses. Let's look at the mobile toddlers and preschoolers. The parent will remove the child from the car seat and walk to designated exchange spot, holding the child's hand for health check. The staff member will take the child's other hand and walk the child into the facility. The parents will check the children in by signing in the CISO log. The pens are disinfected after each use. VPK requires handwritten daily CISO signatures. The staff will walk children to their classroom. The staff member will mark the attendance log and transition tracking sheet when they reach the classroom. At this time, the regional manager or the early childhood development specialist will pause the video to discuss site-specific arrival procedures. During departure, the parent or guardian will drive or walk to the designated pickup site. If outside the regular pickup time, the parent will call the center phone number on the posted flyer to announce their arrival. The staff will mark the transition tracking sheet and bring the child or the children out to the designated pickup spot. For infants, the staff member brings the child in Children First infant carrier to the pickup spot. Maintaining a safe social distance, the parent or guardian will remove the child from the carrier. The parent will sign the child out on the CISO log. Pens will be disinfected after each use. The staff disinfects the carrier after use. At this time, the regional manager or the early childhood development specialist will pause the video to discuss site-specific departure procedures. No one but direct service personnel allowed in the buildings and classrooms. We will limit non-essential visitors and postpone or cancel use of classroom volunteers. We will post signs at the entry and exit, alerting visitors and persons non-essential to the operation that they might not enter the premises. Volunteers, community persons, vendors who must enter the building for business will have the temperature taken upon arrival. They will also sign the site visitor log. Any visit must be pre-scheduled and arranged. The kitchens will have a visitor log for food vendors. We will stagger arrival times. Each classroom will have a designated drop-off and pick-up time as discussed. Should there need to be adjustments for individual families due to work-school schedule obligations, the agency will make accommodations as possible. Staff will greet parents curbside in order to sign their child in and out at curbside. Original signature required for VPK. There has been much discussion about how to prevent the spread of the COVID-19 virus that might be carried into the classroom at the bottom of the shoes. As discussed earlier, staff will change their shoes prior to entering the classroom, while office staff will wear booties over the shoes. If possible, a pair of school shoes for your child could be stored in the center for daily wear. For children who cannot bring an additional pair of shoes to school, staff will develop a plan for disinfecting shoes upon arrival. We have reduced group sizes in the classrooms to implement social distancing strategies. to ensure the same children remain in the same group each day. We will keep groups together throughout the day, and whenever possible, will not combine groups in the mornings or the afternoons. We will maintain an adequate ratio of staff to children to ensure safety, to ensure that groups are 10 or fewer. For early Head Start, we have developed a plan for crib and mat placement. In order to ensure that children's nap time mats or cribs are placed out as much as possible, children will be placed head to toe in order to further reduce the potential for viral spread, ideally 6 feet apart. Let's discuss the changes to the sick policy. Children who come to the child care center sick or become sick while at the facility will be sent home as soon as possible. Sick children will be separated from well children and staff until they can be sent home. Every child will have a temperature check prior to entering the building. If the temperature is 100.4 Fahrenheit or higher, the child will be sent home. Any child with symptoms related to coronavirus will be sent home. The child must be evaluated by a pediatrician, and the child may return with approval from a pediatrician. If a member of the immediate family of a student is diagnosed with COVID-19, they might not attend school for 14 days or until a negative COVID-19 test result. If there is a confirmed case of contagious illness, a health alert will be posted on the classroom door for parents or guardians. The parents shall be advised of the symptoms of COVID-19 coronavirus, PIMS, so they can monitor their family's health status. The parents will be advised to keep their child or children home should they exhibit symptoms of the virus. There have been changes to family-style dining as well. If meals are typically served family-style, the teacher will plate each child's meal to serve it so that multiple children are not using the same serving utensils. The meals will be served either pre-plated or served out by a staff member who does not diaper children. There will be one designated staff person to diaper children, so the other can assist with meal service. Children will have their own individually labeled cup, plate, bowl, and utensils that will be used for each meal. Alternatively, paper and plasticware will be used. Staff will wash hands and use gloves before plating. There will be 4 children for Head Start and Early Head Start per table at meal times. Children and providers will wash hands prior to and after meal service. Children First have developed a communication plan which incorporates strategies for staff and parent training on the reopening and operating protocols. We have ensured that all staff, parents, and partner sites have received copies of the protocols. We will continue to support families and staff to ensure compliance with our protocols. For those parents who are able to comply with all of our protocols, we will recognize them as our COVID superheroes. Risk management has ensured that all aspects of the protocols are in compliance with CDC, HIPAA, and FERPA. Children First reopening and operating protocols have been reviewed and guided by the Sarasota Department of Health. We will inform parents, staff, and partners of changes to the document in writing. After completion of the reopening and operating protocols training, all staff and parents must acknowledge receipt of this training in writing. Our Philanthropy department will follow all protocols in this document. The staff will wear a mask throughout the day, practice social distancing, and increase cleaning of high-touch areas after its use. Our staff will continue to meet with donors off-site and/or virtually. At the conclusion of the training, your regional manager or early child development specialist will be available to take your questions. If you have questions after leaving this training, please contact the Children First staff member either by telephone or email. Together, we can stop the spread of COVID-19 as a team. Thank you.